Block 10 has A, B, C, and D. This is to describe the patient's reason for the visit. Was it related to employment? Was it an accident? So employment incident, auto accident, or other accident? Yes or no to each one of those. It's important to make sure that if it's related to an accident, your primary health care insurance will not cover for accidents. If it happens on the job, you're going to have workman's comp to cover the bill. If it's an auto accident, you may have car insurance that will cover the bill. So make sure that that information is filled out properly. This section is on the far left side of your form. We're going to go through 1A, 4, 7, 11, A through D. 1A, ID number. That's on the insurance card. Number 4, insured's name. Usually the patient's name. Some insurance cards will state the parent's name if it's a child. That information is also on the insurance card. Number 7, insured's address. Retrieve the information from the patient's demographic paperwork. Once again, that should already be in the computer. 11, insured's policy or group number or FACA number. Obtain that from the insurance card. 11A, insured's date of birth and sex. 11B, employer's name or school. 11C, insurance plan or program name. And G, if there's a secondary insurance. This is primary insurance and it's going to pay first. Secondary insurance means it pays next. Secondary insurance. If there is a second insurance to file, you ask yourself, is there a second insurance to file? If so, fill this in just like you did the other section. And this is 9A through D. Once again, it has the insured's name, policy or group number, date of birth and sex, employer or school name, and insurance plan. Signatures. Because the patient has signed the authorization form already in the chart, this section will say signature on file. And the computer prints that out for you. 13, once again, the patient filled out the authorization to allow you to file on their behalf and to receive medical benefits paid to you off to your office on their behalf. It will say signature on file. The bottom of the page, 13, says the medical office reception staff should complete sections 1 through 13. The medical billing specialist should complete sections 14 on. So once again, 1 through 13 should already be filled in. We're going to focus on 14 down. Most medical offices complete the billing process by using the encounter form or superbill to complete the CMS form. So that's all you should need is the encounter form, okay? Let's start with number 14. Day of the visit, we're going to use 32508. You want to make sure you had used double digits. If the patient had same or similar illness in the past, this is important because it may disclose a pre-existing condition. This may disqualify the patient from receiving insurance benefits. Everybody's heard of a pre-existing condition before. It means that you were diagnosed and or treated for a disease or a condition. If you were not treated or diagnosed, even though you may have had it in the past, it's not a pre-existing condition. Okay, so make sure you understand that. A pre-existing condition means you have been diagnosed and or treated. 17. Name of the referring physician. If the patient is referred to your office, then your office can code for a consultation. That gives you a lot more reimbursement than a regular office visit. If no referring physician, you leave it blank and move on. However, if there is a referring physician, we have 17A and B, okay? And of course, all physicians have their NPI number. That is the National Provider ID number. One number fits the physician nationwide. So Dr. James Jackson will have a certain number. It doesn't matter what state you're in. Nobody else will have that same number. 19, leave blank. Block 16 says, if the patient was unable to work because of an illness or injury, please input the first date the patient was off from work to the last date. This is important, once again, if the patient has to file a claim against another insurance company or if the employer is paying for workman's comp. So if the patient was unable to work, you need to make sure you put the dates in. 18, hospitalization dates. Was the patient hospitalized related to the current services? For instance, say the patient is pregnant and was having complications. If the patient is coming in for an OB visit, yes, the hospitalization dates will be related to the current services. So just make sure that you put in there the date the patient was hospitalized or the date the patient was discharged. Your office physician if there is an OB patient, more than likely will actually see the patient in the hospital, and your office will be billing for those services provided by your physician at the hospital. So once again, those dates are important, and we'll cover that later on. 20, outside labs. Did the patient have any outside lab performed by another facility? This is important because you could have a contract with a lab and charge for the services as well. If your office does not do CBCs, however, you order a CBC, you send the patient out, that's an outside lab. The lab allows you to bill that patient for the CBC even though you didn't perform it, and the lab will bill your office at a lower rate. Many offices have contracts with outside labs. 22, leave it blank. 23, leave it blank unless you obtain prior authorization from the insurance company. And of course, CHAMPUS, which is the military insurance, they actually require medical facilities to obtain pre-authorization to bill for services. Block 21, diagnosis codes. The physician should mark on the encounter form what diagnoses, and diagnoses with an ES is plural, IS is singular, he or she is using to justify the procedures on the encounter form. If the physician fails to do so, please hand the encounter form along with the chart to the doctor and just ask them to justify the procedures. It's very important to make sure they justify all procedures so the insurance companies will actually pay for the services.